Hi. Can we have our seat? We would like to start on time. So I would like to welcome you all here and thank you for joining us. And welcome to the 2025 James Dalen Distinguished Lecture for Health Policy. If you don't know me, my name is Iman Hakim, and I am the Dean of the Mellon Inut Zuckerman College of Public Health. And before we start, I would like to read the land acknowledgement. So we respectfully acknowledge the University of Arizona is on the land and territories of indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Tohono O'odham and the Yaqui. The university strives to build sustainable relationships with sovereign native nations and indigenous communities through education offerings, partnership, and community service. So launched in 2008, the James Dalen, with an MD and MPH Distinguished Lecture for Health Policy, was established to honor Dr. Dalen's countless lifelong contributions to the advancement of the University of Arizona and his key role in establishing the Mellon Inut Zuckerman College of Public Health. The annual lecture in his name is designed to raise awareness of public health issues and introduce our audience to emerging ideas from leading experts. These distinguished scholars offer lectures and discussions to our campus community and the public on local, state, national, and international health policy issues and connect the academic world with the real world of public health. We were deeply saddened by Dr. Dalen's passing in January of 2024. His impact on public health, medical education, and this university is profound and enduring. So today, we are honored to continue this lecture in his name, celebrating the legacy he built and the values he championed. We hope that this lecture will strengthen the connection between academia and practice and inspire the next generation of public health professionals. So this year, we are privileged to welcome Dr. Laura Magaña, with the President and CEO of the Association of Schools and Programs of Public Health, as our distinguished speaker. So Dr. Laura Magaña, as I said, is president of ASPPH, as we love to call it. She is also the founding president of the Global Network for Academic Public Health, an alliance of 7 regional associations representing schools and programs of public health worldwide. Under her leadership, ASPPH has continued to advance academic public health by mobilizing the collective power of its members to drive excellence and innovation in education, research, and practice. During her tenure, ASPPH has strengthened academic public health research through the Data Center, launched the Academic Public Health Leadership Institute, and enhance the voice of academic public health through advocacy. Dr. Magaña expanded the association's global reach and is leading 5 strategic initiatives to address critical issues in public health as part of the ASPPH Vision 2030. Dismantling racism in academic public health, climate change and health, framing the future 2030, gun violence prevention, and the ASPPH Workforce Development Center. So prior to joining ASPPH, Dr. Magaña dedicated more than 35 years to successfully leading the transformation and advancement of public and private universities in Mexico, education organization in the United States, United Nations programs, and non-governmental organization in Central America and Europe. She was mostly recently the Dean of the School of Public Health at the National Institute of Public Health in Mexico. Dr. Magaña's diverse portfolio features 90 academic publications, many of which relate to learning environment, the use of technology in education, and public health education. So please share with me welcoming Dr. Laura Magaña.
Well, good evening. Thank you so much for those generous words, Dean Hakim. So I'm so pleased to be here, and I'm already feeling so welcome, and so this town is just incredible. The weather, the warmth is not just the weather, but the people. So thank you for this incredible warmth since this morning, and now I have been really engaged with all of you. So thank you for spending some time with us this evening. And thank you, of course, Dean Hakim, for the invitation, all the faculty, the students of this college, and of course, all our distinguished guests. So it's really an honor to join you today in the 2025 James Dalen Distinguished Visiting Professor in Healthcare Policy Lecture Series, to explore how public health systems can rise to one of our time's defining challenges and opportunities, and that's promoting healthy longevity. That's going to be the topic of my conversation with all of you. So this is not just about the increasing number of people living to 100 years. It's about ensuring that those years are lived in good health, dignity, and purpose. So today, we'll look beyond simply adding years to life. Instead, we will explore how to add life to those years through a strategic framework grounded in equity, prevention, innovation, and population health approach. I would like to start with some information about ASPPH. So ASPPH is the voice of academic public health, representing schools and programs of public health accredited by CIF. We currently have 158 members from almost every state in the United States and 6 countries. Our vision is to improve health and well-being for everyone, everywhere. Our mission is to advance academic public health by mobilizing the collective power of our members to drive excellence and innovation in education, research, and practice. Dean Imam Hakim is a thoughtful leader of our community and has been engaged in different leadership roles, including the chair of the Accreditation Committee for 6 years. She is our longest active dean of the association, very proudly. So we are truly proud of her leadership in our association and our field. But I also need to tell you this story, that 20 years ago, I was the dean of the School of Public Health in Mexico, and the School of Public Health in Mexico was seeking accreditation. And guess who was the chair of the site visit team? Of course, Dean Imam Hakim. So thank you so much, because she made a recommendation with the team to CIF to grant us accreditation. And it was a historical moment to ASPPH, because INSP became the first internationally accredited school in both CIF and ASPPH. So I am forever grateful for her incredible mentorship to succeed with the accreditation process, and that opened the door to schools around the world. Now we have members in 6 different countries. Thanks for visionary leaders like her that we paved the way to really the international engagement. But this school, your school, has been a member of ASPPH since 2003 and continues to be a critical member of our association for the number of programs you offer, for the breakthrough research, and all the difference that you are making in this community with all the intervention programs that you have here and, of course, abroad. You are already doing a lot to contribute to healthy longevity. As an example, I would just mention, really to highlighting some of the initiatives that you have. So, for example, the Center for Participatory Prevention, Evaluation, and Action Research, and the Zuckerman Family Center for Prevention and Health Promotion, both focuses on prevention and critical component, of course, of health longevity. Climate change is a significant barrier to healthy longevity, and the Southwest Center on Resilience for Climate Change and Health is focused on this topic as well. So the Health Equity Research Center and Arizona Center for Rural Health focus on vulnerable and underserved communities, health equity being key in ensuring really health longevity. And of course, you're training the current and future public health workforce to meet really the needs of today and tomorrow in this critical topic. So at ASPPH, we are currently working toward our strategic plan 2030. And I want to just highlight our first goal to advance solutions to the critical public health challenges facing society, which is this one, 1.1. And in that one, we have identified healthy longevity as one of these critical challenges and have established a task force to develop a framework for our members on this issue. So I will share some of the preliminary findings and recommendations of the task force. So to understand where we are going, we must first honor how far we have come. At the turn of the 20th century, life expectancy in the United States was just under 50 years. Deaths from infectious disease, unsafe childbirth, and poor sanitation were widespread. The modern field of public health was born out of necessity to prevent death at scale. And it worked. Thanks to immunizations, clean water, tobacco control, road safety, chronic disease prevention, life expectancy has increased by more than 30 years. So as Dr. David Satcher once said, public health is a silent victory of the 20th century. But now we must ask, what is the victory of the 21st century? We have added years to life, that's true, but now we must add life to years. Healthy longevity represents the next great frontier of public health. And like sanitation or vaccines before it, it demands vision, infrastructure, and investment. Recent demographic trends paint a clear picture. Half of the children born today in a developed world may live to 100 years. But the real question is, will they live well? Our public health system must be prepared not only to support longer lives, but to shape the conditions, social, economic, and environmental, that make longer, healthier lives possible for all. This requires a profound paradigm shift from managing aging as a burden to embracing longevity as a societal opportunity, what some are calling a longevity transition. So for too long, aging has been viewed through a lens of decline and burden. Aging is threatened as a crisis, one we brace for fear or even ignore. Media headlines warn of a silver tsunami or demographic time bomb, but what if instead of a crisis, we saw an opportunity? A longer life can be a social asset, not a burden. Older adults contribute with wisdom, mentorship, caregiving, civic engagement, and economic value. In truth, the longevity revolution is a public health success story, a reflection of vaccines, sanitation, safer childbirth, and improved chronic disease care. Now we must match those achievements with a vision for the next frontier, ensuring that those longer lives are lived with vitality, with purpose, and equity. This requires shifting our narrative from managing aging to crafting a longevity society, where the years we gain are matched with years of function, contribution, and connection. This shift is already underway in visionary models, like, for example, the Standard Center for Longevity. It has a new map of life, which reimagines an 100-year life as one field with multiple stages of learning, purpose, and contribution. So not just extended retirement, it asks, how can we configure or reconfigure work, education, housing, and health systems to support vitality across a century? So this is not just the Stanford's question, it's our question as public health leaders. So let's be clear. The trajectory of a 100-year life is not set at age 80 or even 60. It has to be shaped by, number one, early life experiences like housing, nutrition, education, midlife exposures like chronic stress, income inequalities, or occupational risks. And of course, in the cumulative environments like climate, population, community supports as well. So in short, the foundation of healthy longevity is built across the lifespan, and public health is unequally positioned to really shape every stage of this lifespan. Research shows a troubling truth. Americans live longer than ever, but spend an average of 12.4 years in poor health at the end of life. These years are often marked by chronic diseases, disability, and isolation. And these experiences are not distributed equally. They reflect deep inequalities tied to race, income, education, and geography. It is not enough to celebrate longer lives if those extra years are filled with suffering, and longevity is concentrated among the privileged. Public health must address the social, economic, and environmental determinants of aging outcomes, from access to nutritious food and green space, to income security and medical care, to ageism and social isolation. So this is our charge, to expand not just life, but life with health, especially for those historically left behind. So let's also talk about cost and values. We often hear that aging populations will bankrupt the system. But the real threat is not aging, it's unhealthy aging. Unhealthy aging will certainly bankrupt our system, right? But when people live longer in poor health, it results in higher hospitalization and long-term care costs, greater strain in caregivers, workforce shortages, loss of productivity. But investing in healthy longevity pays dividends. For example, CDC estimates that every $1 spent on fall prevention saves $3 to $4 in hospitalization costs. Community-based aging programs like Capable and Healthy Ideas reduce Medicaid and Medicare expenditures. Keeping older adults healthy and employed longer supports economic growth and intergenerational financial stability. The Milken Institute estimates that extending average health span by just 1 year would add $38 trillion to the US economy over 50 years. Healthy longevity is not just a moral imperative, it is a fiscal strategy as well. So to craft a public health framework that truly supports healthy longevity, we must begin in the classroom. The public health workforce of the future must be equipped with the knowledge, the tools, and the mindset to lead in an age of extended lifespans. This requires a shift toward public health 4.0, an educational and practice model that reflects the realities of today's interconnected, data-rich, and equity-challenged world. Public Health 4.0 calls on us to equip the workforce with data fluency, systems thinking, equity literacy, community engagement, and technological agility. But it must go further. To support healthy longevity, education must also embed the life course perspective across the curriculum. Teach aging as a systems issue and not just a gerontology subfield. Address the biological, behavioral, and societal drivers of aging outcomes. Include interprofessional, community-engaged learning focus on aging populations. In short, we must train professionals to create conditions for healthy aging and not just respond to illness in the old age. Public health is global health. The interconnectedness of our world is irrefutable. The COVID-19 pandemic made that inescapably clear, right? So public health systems must foster global partnerships to share data, practices and scale all the solutions that are taking place in other places, while customizing, of course, the response to local community context. So, for example, from Bogota's care blocks to Japan's caregiver supportive policies, the world is full of tested ideas for supporting older adults that also uplift all the communities. Climate change is one of the greatest threats to healthy longevity, especially for vulnerable populations. So heat waves increases cardiovascular risk for older adults, as we all know. Disasters disproportionately displace elders. Poor air quality accelerates fragility and cognitive decline. Our framework must integrate climate adaptation and environmental justice as core pillars of community health planning. Public health must lead efforts to reduce environmental risks and strengthen community resilience. Gun violence, claiming over 100 lives daily, cuts lifespans short and erodes community trust. Loneliness and ageism contribute to mental and physical health decline in older populations. Loneliness rivals smoking and obesity in its impact on mortality. And ageism undermines policy care and inclusion. These are not fringe issues. They are core public health threats to longevity. Ageism alone leads to undertreatment, exclusion from trials, and internalized stigma. It costs the US economy billions each year and devaluates the wisdom and contributions of older generations. We must treat this not as a social issue, but as a health equity challenge. Healthy longevity is impossible without addressing safety, connection, and dignity. What's the role of our institutions in this transformation? Schools and programs of public health are not just training grounds, they are engines of societal change. They must model what it means to be a healthy longevity. Oriental institutions, not just through what they teach, but through how they partner, whom they reach, and the policies they influence. ASPPH Task Force on Healthy Aging is about to release its report on the upcoming months, and they have identified many recommendations, including reframing the curriculum, developing aging-related competencies and content for foundational and advanced courses and cross-disciplines, epidemiology, health systems, and health policy, etc., that can be shown with our case studies with healthy aging populations. Integrate healthy longevity as a cross-cutting theme, just like health equity is. Include practical tools for designing interventions that extend health span, not just treat diseases. And include case studies on health aging across the curriculum. Promote interdisciplinary, intergenerational education. Create joint degrees and certificate programs that link aging, public health, and medicine. Incorporate intergenerational learning and community voices in the classroom. Offer workshops for elders on digital literacy, nutrition, and self-care. Join movements like the Age-Friendly University Global Network, which already includes 25 ASPPH member institutions. Invest in workforce and career pipeline development. Build partnerships with local and state health departments to co-design practical experiences focused on aging in place, dementia prevention, and elder-friendly environments. Offer continuing education in aging and public health for professionals in clinical, social, and administrative roles. Develop micro-credentials and stakeable certificates in topics like life course epidemiology, neuroscience in public health, or healthy longevity leadership. Track alumni outcomes in aging-related roles to better understand workforce needs and support their development. Conduct research into healthy longevity. Numerous research opportunities exist to expand understanding of factors associated with healthy longevity and to understand the role of interventions and policies to promote healthy longevity across the life course. Key research domains include ageism, loneliness, and social isolation, lifelong environmental exposures, and, of course, neuroscience. Healthy longevity research should explore prevention across 4 life stages: the early life, young adulthood, midlife, and of course, the older age. Incorporate healthy longevity strategies into practice. There is a long-standing gap between research and practice in public health, especially regarding interventions that support healthy aging. So we must incorporate healthy longevity strategies into practice, such as promoting lifespan healthy behaviors, address structural determinants that worsen aging outcomes, and target key challenges in aging populations. Emphasize the importance of interprofessional teams for healthy longevity. Evidence-based interventions exist, but many are siloed or underutilized. Public health must accelerate transition to practice through cross-sector collaboration with housing, transportation, and technology, and systems-based approaches that integrate aging services, primary care, and prevention. Lead local and state advocacy. Support states in developing master plans for aging that prioritize public health and prevention by providing data analysis, hosting listening sessions, and training staff and community leaders. Embedded schools and programs of public health as policy partners, not just academic observers. Schools and programs of public health can and must be hubs for innovation, workforce transformation, and public engagement around healthy aging. Incorporate lifelong learning initiatives, the 60-year curriculum. And I don't know if you have heard this phrase. So one practical example of an outcome of healthy longevity is the need for lifelong learning. Students and workers no longer expect their jobs to represent a linear progression from 4 years of college into a single career. They instead expect their current job or career at some point to disappear or evolve. So forcing them to prepare for novel jobs in several new careers at unpredictable moments throughout their lives in a world shaped by globalization, environmental crisis, and artificial intelligence. So learning and working merged into one entity for the rest of our lives. Job transitions have become an established part of our lives. Workers now experience at least 12 job changes by the time they retire and stay in the workforce at historically high rates into their 70s. Through the lens of human longevity, work becomes inextricably tied to education. Many will need to work until mid-70s to even have enough savings for retirement. So the 60-year curriculum, coined by Gary Matlin, refers to a new perspective oriented toward continuing education and centered on 6 decades of employment, requiring a lifetime of learning in the context of repeated occupational changes and transitions. In public health, the needs of the population are evolving all the time. So new threats to the health of populations and the planet are constantly evolving. So it's impossible to imagine that we will be satisfied by having, let's say, an MPH degree and not going back to school ever when the needs of the populations and the planet are constantly changing. So our profession is a living system where we need to constantly be uplifting our competencies to keep up with the new viruses, threats, and innovations to protect the health and well-being of our populations. So periodic returns to learning are the new normal. There will need to be more on and off ramps for long life learning in public health. We will need to harness the power of education, gaining what we need and seamlessly re-entering the workforce highway. So learning and working are becoming inseparable indeed. This is precisely what it means to have a knowledge economy or a learning society. It follows that if work is becoming learning, then learning needs to become work. And schools of public health need to become living systems to open, encourage, and promote flexible possibilities. Embrace technology and innovation as an engine for equity. So technology holds immense potential to support healthy aging, from wearables that detect early fragility to apps that support medication adherence to AI-powered tools that predict health decline. But innovation must be guided by equity and co-created with older adults and communities. We must invest in technology that supports aging in place, community-based health models that blend medical and social care, cross-sector partnerships that build environments for long-term health. Advocate for policies that shape the conditions for healthy longevity. The US faces a growing crisis. Longer lifespans paired with rising years of ill health threaten not just individual well-being, but national productivity, economic stability, and health systems sustainability. There is an urgent need to recalibrate investments, shifting from reactive acute care toward preventive life course health promotion. Some concrete policy changes include investing in housing, transportation, caregiving, and nutrition, funding aging research and innovation, reforming payment systems to support prevention, not just treatment. And our public health system must redefine aging, not as a decline, but as a phase of potential, productivity, and partnership. So, what do we do starting now? What comes next? We don't have to do everything. We can't do everything, but we must start doing something. So let's commit to integrate healthy longevity into our teaching, research, and practice, to listen to older adults as co-designers of solutions and our curriculum, to making equity, purpose, and dignity the cornerstones of aging policy. Healthy longevity is not just about adding years to life. It's about making every year count. And if we succeed, if we reimagine what it means to age, if we empower people to live fully at every stage, we won't just change public health, but we will change the future. Thank you. Thank you. Or a comment, or feedback, or, yeah. Yes, right here.
Hi, met earlier, Lupita Murillo, retired from KBOA News for Tucson. I was a reporter for 46 years here in Tucson. You talked about gun safety. I covered the crime beat for 46 years. How do you propose to combat gun safety? I mean, this is, you mentioned 100 people are dying a day.
Yes.
Because of gun violence. So
Exactly.
Obviously it's a problem.
Oh, it's absolutely a problem. I really invite you to, we do have a framework in ASPPH about gun violence, which includes suggestions, recommendations, things that we are doing right now in very different, it's a multi-sectoral problem, or societal problem, that we all need to, we all play a role in that. So in terms of education, for example, we need to really include that in all our curriculum, and all our students need to be aware of the problem, because it is a problem there that we need to be aware, we need to be working with our communities. We need to advocate. Of course, one of the things that are in our framework is that we need gun control. And that's one part of the problems, right? That we need to really have really strong laws and regulations in terms of what are the kind of guns that people can have in their own homes, because there's like too much availability as it is right now. Mental health issues. We need to work with people, with adolescents and with adults, with all the communities, because there's a lot of problems in the mental health arena that actually, that are really causing this pandemic right here. But there are also some other issues that are happening. For example, bullying in the schools. Some of the things that we're seeing in all the shootings in the schools are really caused by more of the interactions that are happening with the adolescents and the schools, the schools environment. So our schools need to also work more in terms of really be dealing with these problems inside the schools, with the school environment, with all the kids. So as I said, I mean, gun violence is a problem that really interacts with so many other actors, and we need to move forward this issue because it's a big issue right here in the States. So we are advocating for all of those strategies, and there are some examples in the community that help, and that can we get just to know more in order to really disseminate more nationwide. But happy to send you our framework. It consists. It has a lot of the recommendations there.
Are you finding that the individuals that are involved in this gun violence are under the age of 25?
Most of them? Is
Yes.
that, yeah, there's a big issue there. Yes, absolutely. And if you add this with really violence and with other of the social conditions, you can tell that in the ages of 15 to 25 is a big problem in terms of violence, gun violence, and then of course sometimes even they're taking their own lives. So yeah.
Thank you.
You're welcome.
Hi, Laura. Thank you very much for your presentation. As you know, one of the issues with public health is that as part of our soft power, that we are able to generate peace and prosperity around the world. And more recently, we're losing PEPFAR, we're losing USAID. Talk a little bit about the ramifications globally of the loss of those essential programs.
Yes, we cannot deny that we're living globally, nationally, but globally too, really a crisis right now. And in public health, we are suffering a lot about this. I mean, if we think about for example, right now, all the schools that have lost all the grants, for example, for research. So it is a time right now to come together to look at our fundamentals of what we do as public health, go back to the essential things that we do, and then we need to redistribute what we have in order to really continue doing what we do, because we cannot resign to what we do. We will continue doing what we do, what we have. And I think that is a time where all the society has to come to, for example, continue to advocate, and we will continue to do that. We need to advocate, and we need to, some of the things that, that we're looking is that maybe public health has not done its job in communicating to the public. What do? We always said we are the invisible workforce, and we kind of have even a proud of that. I don't know why, but we think because everybody's fine until we have a crisis, right? Until we have a pandemic, until we have a shoot or something, a hurricane, and then we know that where public health is. But I think that we need to do a better job in communicating what public health does. And if we just think about one of the things that I said, for example, if we think about the last 100 years that we lived, how come people, they don't know that they now live double the life expectancy because public health measures. It's because of that. It's not because just like evolution or anything else. It's because everything that we did in safety, water and the roads and the tobacco control and all of those things, but those were public health interventions. So I think that one of the things that we need to learn is that we need to communicate better what does public health does and why everything starts with research in public health in order to know what's the evidence that we have in order to see what the interventions that works. So in these critical times, I think it's a time to really be very self-critical as well. In terms of public health, I think one of the things that we need to change, and some of the things that we need to change is definitely communication. How do we communicate with people? Of course, with politicians as well. And then how to really move forward, building capacity national and globally. I mean, we're working right now with so many countries that right now are devastated. And are devastated because they said, for 50 years, for more, I mean, we have really rely on all this money. But if you go to those countries internally, the capacity is not there yet. So it's like, why after 50 years of funding, the capacity is not there yet? So I think that something is there that we need to really change in the way we approach even funding and even the global collaboration. So I think that definitely this crisis, it's forcing us to rethink public health and public health globally, and what are we doing really with the funds, and how can we really reimagine the way we work. And it's going to be tough. It's going to be tough. It's going to be really tough. But we're going to get there. I think that we need to just reimagine things that we're doing. And then we need to learn from other countries as well. I mean, there are some other initiatives in other parts of the world that are working with much less money than in other parts of the world. It's more like really need to humble ourselves to learn more about others, what they are doing and what works, right? It's tough, it's tough. I cannot tell you. Yes, it is.
Thank you. Oh, she knows me. The other comment I would make is of really concern for me is that public health is also national security.
Yes.
Because as these countries are deprived of food, water, medical care, it creates instability. And, you know, quite frankly, the United States, when they function well, is the great stabilizer around the world. And as NATO falls apart, and as these programs go away, and populations are forced to emigrate emergently, we have wars. We have people fighting for food. So I think that I'm really concerned of the ramifications before us unless we get a course correction.
No, absolutely, and we share that concern. One of the things that we're thinking is that exactly what you're saying. Public health has always been, or us in the health professions, we always think that the others get it, that health is health, is well-being. Everybody cares about that, right? So we always communicate in healthy ways, right? We never touch the economic or the safety issue. And now we are realizing that the change in the way we talk about public health has to be in economic terms and in safety terms, because those are the terms that people that don't think like us think. It's like, if we make the economic case of public health, I mean, it's obvious, but it's obvious for us. We have not really done our work and our homework in really putting the economic case of prevention, which is really, we can make very easily that case. But the other one is the safety case. We do have public health is safety. It's national security, and we all know that we are not safe until every single person around the planet is safe. And we know that about infectious disease. We know that about the pandemic. But we need to really, that's the part that we need to do our work now. We need to really redefine how we talk about public health. Because yes, public health is this moral and social passion that we all have here. But we need to face it, that not everyone is moved towards those values. And we need to really convince the other people that, you know, public health is also about saving money. It's also about our own safety nationally. It's not, so we are not doing like the global work because we're, you know, philanthropic world. No, it's because also it's a safety issue, right, for everyone. So yes, you're right. I think we are all concerned, but we are also, I think, there's hope because all of us are working, you know, in an everyday basis in order to find the ways to continue working, to continue doing what we do, and all of you, and thank you, all of you are doing a great job today. I was just working on talking with your students and with your faculty, and it's amazing work that this school is doing, and please keep on doing it. We can do it, and we will go through this too. There has been, you know, times in history that I know has been really, really tough, and we will continue doing things, maybe in a different way, yes. Maybe it's a way to reimagine things and going outside of our comfort zone and just doing things in a different way, but we have to do it. We have to do it for the generations to come, so, yeah. Yes.
Hi, my name is Zhao Chen. I'm a professor and social dean for research in the college, and also run the Healthy Aging Lab. So what you talked about today, really music to my ear. So I just want to come and say how important for everybody to realize the importance of educate our students as well as doing research in the area of healthy aging. Couple of comments. I think for education perspective, we have tried different approaches. Having tracks, have standalone classes, as well as providing students the research experience on aging research. But also try to provide modules so faculty can use that in their different classes. Exactly. Not all the students would take aging classes.
Right.
The challenge we're facing, we have, I think the students interests, perceptions on aging, and cross-board has been preventing them taking some of the classes as well, focusing on aging issue. So I want to hear you about the association strategies. I heard you talking about aging curriculum, how to make aging as a way people think about it's not burden to the society, but treating aging population as resourceful and we are eager to work with this group. Why don't I tell you, one time I asked a student, how many of you would like to working with maternal health? Half of the room raised their hand. And they asked how many of you would like to work with environmental health. Another 1/3 raised the hand. Asked several questions, and then we're talking about aging. Was only 2 students among the 60 students raised the hand. So I think it's continuous struggle for us to raise this aging workforce. So love to hear your thought on this.
Thank you so much for everything that you're doing. Thank you for the question. And that's kind of natural just because this topic is kind of a new topic for us. We don't talk about it. It's just like, oh, we need to start doing something, right? And that's why we need to start from even the language we use for it. That's why we're very careful about talking about, this is healthy longevity. We're talking about health span. We're talking about all of us. Because in a better situation, with healthy lives, we all are going to go, and all of you, the students, especially the new generation, are going to arrive to all these 80s and 90s, and maybe even if they're lucky to the 100s. So what are we doing with those lives, right? So I think that the more we talk about it, it will be more mainstreaming, the topic, first of all. So the one thing is that we need to start talking more about it in order to be more present in our society, in our talks, the way we do things. Secondly, in terms of the education, what we're trying to do is that, yes, some schools are doing what you were describing, maybe areas of concentration, maybe courses, but some are actually even starting just with developing, for example, case studies that any classroom, any course can integrate in their course. So you can be talking about epidemiology or health promotion or whatever the class is, but here is the case study about healthy longevity that you can use in your own class. So it's not putting together another course or another area of concentration. It's just starting to include more lectures and more articles and more case studies in your class about healthy longevity. So the students started to be, facing with this issue more often in the classroom. The other thing is just trying to do more intergenerational classes. So you can actually invite to your class some adults, some people who are, older adults that can come and just talk about something, maybe an illness or something that prevention or something, whatever the topic is, but bring them into the classroom so it will be more natural for the students to actually be talking, be working with one of them. Work with them in the community. Try to select, you all have incredible linkages and partners in the community. Well, make this a topic. Find who is working with other adults in the community and try to find some linkages with the School of Public Health and maybe some practicum, some internship or something with these communities. So the whole thing is just to make more visible, I would say, the work that you're doing with them. And of course, hopefully some of the researchers also will start to see this as a lifespan, like a continuum and not just like, the adolescents or adults or the old elderly. No, this has to be, in the research perspective, more into the lifespan of just our lives. So some of the things that we are just trying to do, but as soon as we have our framework, which is going to be like in a couple of months, I would definitely will share it with Dean here, because it's going to be full of recommendations for education, for practice, for advocacy. How can we really start making the economic case with our legislators in order to advocate for more practices with them. And this, of course, is a cross-cutting theme for not only the health professionals, but around the campus, because this has to do also with transportation. It has to do with the parks, with the architects, with the lawyers. So if this is a topic of a cross-cutting course, that would be awesome as well, because everyone's going to start talking about it, not just the health professions, but also the others that really connects with healthy longevity. So thank you for the question.
Thank you. Yeah, we always say we need a village to raise kids. We also need a village to care for older adults.
Yes, thank you.
Thank you so much, Laura, for the presentation and for all of the insights that you shared this evening. It couldn't have been more timely. I don't know what it's time for me to also announce that our college is going to be launching an emphasis in healthy population aging very soon.
Wonderful.
We already currently have an undergraduate minor in aging that we're trying to revamp, working with the College of Science. But I think in developing these programs, one thing that I find that we are not emphasizing as much as we should is the life course approach. I think among us in public health, we all understand that many of the conditions that you talked about that we face as we age, the foundations were actually laid, from even preconception. Exactly. And so everyone desires to age, to live long and to age. But if we remove the life course perspective from it, then younger people do not see the value for them. And I think as we move forward in marketing these new programs, my intention is that we're going to be hammering seriously on the life course approach and also the intergenerational aspects that you talked about. So a lot of important issues that you raised tonight. So thank you so much.
Thank you. Thank you for your comment. Yes.
All right, thank you for that, Dr. Magaña. As a physician with public health expertise who has held the hands of thousands of physicians or patients through their chronic disease conditions, I think that the topics that you raise are phenomenal and extremely essential. I love the thought of a 60-year curriculum, and I would argue that as our population ages, maybe a 70, 80-year curriculum is needed for lifelong learning. My question for you is, I know, having public health exposure, a lot of our community resources, but there is a gap that exists in the clinical world at the bedside and the chair side, where you limit yourself to what is covered by insurance. And sometimes we limit our patients to just those resources. But there's a wealth of resources in the community. Yeah. And how do we bridge the gap between the bedside, the chair side, and what exists in the community as a result of our public health efforts?
Great question. Thank you for that. And this is up to all of us. I think that that's exactly why the public health schools, and I actually, this school of public health is just amazing, the incredible work you do in the community. So knowing those gaps is one of the questions, the research questions, the practice questions that we have when we go to the community. And let's map what the community already has to offer, and let's start working with them. There's a lot of even religious, community religious groups, and then there's others that are like nonprofit, there are others that are like civic. So many, as you were saying, resources in the community that we need to start just working with them and through them and with them in this topic, because this is a topic that requires that all of us are together, and there's so much that we can do in the communities and the different groups. So I think that is just a way of how do you engage your community and know your community in order to start really emphasizing this issue and working everybody together in just bringing a healthier aging for all of us, right? yeah. So, but
And there must be a way to
Yeah.
empower our health professionals, our physicians to use these community resources. Because I'll tell you that a patient who is completely isolated won't go visit their family. They'll never miss their appointment with their physician. And I think that's a critical moment where we can intervene and get them connected with the community and prevent some of this isolation from going on. And so I'd be more than excited to look into some of these research opportunities.
and also look at the global experiences. There are incredible projects right now and interventions in this area around the world. Just very quickly, one in Denmark. So, you know, in Denmark, they put together the life libraries. So it's libraries that you go, and there are older adults that they say, you know what, my story is about migration, for example. So I can come to the library Wednesdays and Thursdays at this time. And my story is about my childhood because I have a violent childhood, and you name it, the different topics, right? And they actually write down when they can come, what's the story and when they can come. So the students, even the children from primary, high school, or college, let's say you are researching the topic of migration, and you go to the library for a book, right, for migrations. Instead of a book, you have this person here that's willing to talk to you 1 hour of their time about their story. Isn't that a beautiful model? I love it. So all of the library, you see the people around with the intergenerational, so the older adults with their stories, right, talking with the kids or with the teenagers about their stories, and then it's for their homework or something. So there are a lot of like mentoring. There's a lot of experiences already in different parts of the world. It takes time to just research all those things, and they say, oh, that could work in my community. Let's try it, right? But experiences, because this is not happening, of course, just in the United States. This is a global challenge right now. And there are some countries that actually have already arrived to this challenge even before the United States. So let's look at them, what they are doing. And there are some very successful stories about it, and we need to learn. We need to learn from them. So, thank you.
I just have a question about one of the comments you made, which was that we're not doing a great job in public health communicating our stories. And so I'd love to know what you might recommend for people who are just starting to get into trying to communicate these stories. Where do we go? Where do we take these stories? How do we start that process of really amplifying that?
Thank you for the question, a very important one these days. Well, first of all, a promotional, because we, ASPPH, is right now as we speak doing a project and actually collecting the stories about public health around our schools, around the country, in terms of what it is, what's the story about public health that impacts your life as a kid or a woman or a man or whatever the topic is, because we are terrible in telling our story. We have not been able to tell our story. We are not storytellers, right? So I think that's something that we just need to learn more how to do it, and we need to tell more the story about what we do. I don't know if that's true for you, but let me tell you that in my 25 years engaged seriously in public health, until maybe before the pandemic, like in 2020, my mom or any of my friends would know that, what is exactly what you do? I mean, for more than 20 years, I keep on telling them what I do, and still they were like, until the pandemic came. And they were like, now I understand what you do. She's like, why? I mean, how come you didn't get it before? Why I didn't tell you what? So I think that we really have a problem. We really have a problem in how to explain what public health is and what do we do to advance the health and well-being of everyone. Everybody understands medical degrees, right? Or what a cardiologist do. So why they don't understand what a public health person does? So I think it's just telling more our stories, not just the successful story, but all our stories in terms of vaccines, in terms of water sanitation, road safety, whatever we do, or whatever public health is. We need to do more about that. And sometimes people think that public health is about, don't smoke, do exercise, eat better. It's more like, the person who's telling them what to do or what not to do. And some people think that that's why they don't relate very well with public health, right? But public health is just so much more than that, right? So I think that we need to just be very specific, we need to even say, what are the phases of public health? What does that mean to, if you really eat well, what happens? You know, what's the story of Mary or John or, you know, this other kid or this other person? So to be more very specific about the people in order to the others understand, oh, that's why it was important to have the seatbelt or whatever. But now there has been some serious, I would say, like projects in order to put down like what are the stories. So as soon as we have like the project or the stories, I'm going to send it to everyone so we can use them to communicate more. But I think that one thing that we have learned also is that in our curriculum, in our schools, public health, so we need to really emphasize more the part about the competency in communication. It's not just communicating with, our research findings in the reports on our journals, which of course is very important, but it's also extremely important how to communicate what I do to the public, to the community, and to the policymakers, that they don't read, the whole articles. They read just like, they give me one paragraph of what does that research mean. So we need to do a better job in communication, and there has to be a competency that all our schools, all our graduates need to have to all audiences, not just for the journals. So, thank you.
So we'd like to thank Dr. Magaña, and as a token of thank you from the college, we'd like to give her a little gift so you can have it on your desk for your visit to Mescal. Thank you very much.
Thank you. Thank you. Thank you.
Thank you very much.
Thank you.
So I would like to thank you all for being with us today, and I hope to see you next year also in the Dalen lecture series with a new guest. We still have the room, and I hope you still enjoy around a little snacks, and Dr. Magaña will be around for you, and we'll be here until 7, so feel free to mix. And again, thank you, and see you next year.